Welcome to our first session of the 7th Annual Health Philanthropy Summit. And this morning, we're going to kick off Thriving in VUCA with a further explanation of the V in VUCA, otherwise known as volatility, and how you can manage it. And by managing it, we mean reach a new level of vision. And for this, we are going to use campaign feasibility during a pandemic as our case study. Joining us today from Missouri to share his experience with us is Phelps Health Foundation Executive Director, Dave Selzer. So a bit about Dave. When Dave was a young father, one of his 4 children was diagnosed with a brain tumor, which led Dave and his wife, Barbara, to getting a very fast education in healthcare, nonprofit, and philanthropy. Learning from his experience, Dave started looking for a career in the nonprofit world. He was the founding executive director of the Illinois Heart and Lung Foundation, and then he went on to various positions, including a year as the regional director at the St. Jude Field Office in Peoria, Illinois. He continued to use his ability to embrace organizational missions by working at the Provena Covenant Medical Center, where they launched their first capital campaign in decades, and then had to deal with the loss of their tax-exempt status and the impact it had on their donors. Following this, Dave took a leadership role at the Community Cancer Center. Today, Dave joins us from Rolla, Missouri as the executive director of the Phelps Health Foundation. And when Dave moved from Illinois to Missouri to take this role, he started, and then 2 months later, while contemplating a feasibility study for a capital campaign, COVID gripped the world. So that's a lot. That's a whirlwind. Thank you so much, Dave, for joining us.
Thank you for having me. I appreciate it.
Yeah. So we've got so much to talk about with your case study for feasibility during a pandemic for your emergency department. Before we get into the real meat of it, I would love for you just to describe to our audience, tell us about the Phelps Health Service community. Tell us about rural Missouri, and what were the primary reasons prior to COVID, prior to the pandemic, what were those primary reasons behind wanting to conduct this feasibility study for an emergency department in your rural community?
Sure. So Phelps Health recently became Phelps Health. We used to be Phelps County Regional Medical Center. The medical center is still a county entity, so it's a county government. However, we receive no tax dollars or anything, but our governing trustees are elected. There's 5 of them, 1 up every year. It's a 5-year term, and they are the governing body over the Phelps Health itself. What Phelps Health has experienced a lot of growth. It's bought most of the practices in the area. So we have a large primary care and specialty care presence. We have a helicopter so that when we do cardiac caths, we can take patients as, if they need to for open heart surgery, and also for traffic and other incidents from just outside of St. Louis down to almost wherever, Oklahoma. And we're located about halfway between Springfield, Missouri and St. Louis. St. Louis about an hour and a half, Springfield's 2 hours. A great portion of our service area is underserved, and it's a high at-risk population. So, we really have some opportunities to provide service and live our mission of being a healthier community and helping all of those that, with wellness who we serve. So the one thing that we really focused on was our emergency room. Our surveys and patient satisfaction came back not good, not the worst, but not great like we'd like it to be. And a great amount of the angst that patients had was the facility itself.
Right.
How it was laid out. I think we only have 1 room, and then we have a backup room for mental health. We can be using 12 mental health beds in the ER at one time now. That is just continued to grow. We don't want it to, but it is. It's a fact of life. So we started down the road of talking about, okay, how do we build a new ER? And how feasible would it be in today's environment? This was today's environment prior to COVID. So And then, as all of us know, COVID changed the world. So that's what brought us up to the point of picking up the phone and calling Jennifer and saying, help, we need to do a feasibility study.
So tell us, I mean, as I mentioned in your introduction, you've had, roles in all different shapes and sizes of markets. So what is special and unique about this market from, a relatively newcomer perspective?
Well, even though the market itself has probably 200,000 people, the city of Rolla is 18,000 people. So the rest of those people are scattered around through the counties. It is very small. It's small town USA, and it's wonderful. Everybody knows everybody. Everybody who gets behind a project, the whole place gets behind the project. But conversely, if people don't get behind the project, then a lot of people are skeptical. So that was also one of the paths we had to navigate, because with all the change here with the medical group, and some people were for it, some people were against it. So we have to reprove ourselves every day, and every practice has to prove themselves to not just their patients, but to their patients' friends who go to other practices. So it is a very Mayberry, and I say that in a good way, because everybody does know everybody, and you can pick up the phone and get just about anything you need and anything done. But you just have to exercise a lot of caution with what you say and how you say it. And somebody's related to the person you're talking to. So
yeah. And we'll get a little bit more into that in a few questions here, but change is inevitable in business, and especially healthcare. And when you combine that with a pandemic and a few other outlying incidents, Phelps Health found itself in some potentially volatile situations. And typically when we conduct these feasibility studies, we uncover comments about a hospital's perception of wealth, or, as you had mentioned, a real need to improve a facility or improve services. And that's something that philanthropy can address. But you had some really unique situations around significant leadership changes. And also, I would love for you just to explain a little bit further for folks who may not understand the interesting dynamic that could be potentially volatile with your board leadership and the fact that they're elected. So I would love for you just to talk a little bit about your CEO change, and then just a little bit about what that dynamic is about, how, because your board is elected.
So we do have, as I said, 5 elected board members. And when you have 5, as we all know, a majority of a quorum is really 2. A quorum, a majority is 3, but they only need 3 to conduct business. So you only need 2 votes to make things happen. So generally speaking, that's not an issue, but when some of the board changes and it shifts to a different philosophy, you can see a lot of change as a result. So it all started, I think, on my birthday of this past year, and our senior vice president in human resources was walked out of the building. And after that, of course, everyone is wondering why, and a million questions happen. And just a few days later, then the board met with the CEO, and he was exited that day. Also, our chief medical group officer, senior vice president, was exited. Our information technology leader was exited. Our OD, occupational or development, was exited, along with some other director levels. The new CEO was our former COO, and a little sidebar on that is he's the one who I first met and started talking to about the emergency department project. So he was chairing that for the administration. So he was very supportive when he came into the new role. Like I said, this is a small town. We are. That's a lot of change and a
lot of questions and a lot of tongue wagging.
Yep, 2,000 employees here, and remember our base is 18,000. There were questions everywhere, just everywhere. So, and people, absent the truth, people make up their own answers. So there were a lot of people who just thought, oh, this happened or that happened or different things. I think the answer is change. The only thing constant is change. And this board changed, and the new board wanted to see change in the medical center. They wanted a different approach. But at the end of the day, it's still about the mission. It's still about providing top care. And our new CEO, along with this board, although it be different from the last board, they're very supportive of what we're doing. And, that brings us up to where we are today. Since the shakeup of leadership, we've had a change in how we have leadership. We have a CEO and a couple senior vice presidents, and then there's, I think, 12 executive directors. So basically service lines. And that makes up the senior management team. So it's leaner. We make decisions quicker. So there's some really good things going that have won the employees over. I know today they're super happy as we look at some of the things that are happening with the mandate for the vaccine and being put on hold, even though we all support vaccines. So that's just another element that's out there. Everybody I talk to, it's a discussion, about whether you should get a vaccine, whether it should be forced on people, all of that. So those are real options, real volatile options, as we're trying to raise a couple $1 million.
Right. But two things that, taking that volatility division, I think that two things that Jason, your new CEO, just from an outsider's point of view, in terms of culture that I've noticed, yes, you're now positioned you're making decisions faster. I see you as a more agile unit, but also, and just to get into the weeds a bit, I really liked what the cultural rule that he instituted. I don't know if he still has it or not, about the meetings. Does he still have that?
Yeah, 8:30 to 10:30 in the morning is no meeting time.
No meeting zone, so that everybody can focus.
Yep, focus on what you wrote down on your to-do list from all the meetings yesterday. And we also use Zoom chat and OneNote. So we'll go into OneNote and show, what did we do yesterday? What do we do today? What's my obstacle to success? And if I could change one thing, what would it be? And I do that every day along with the rest of the senior team, and we can look at what everyone else is doing. We can also see if other people are having the same challenges. It's just great. And now, as we've been doing this for a couple months, people are being more honest. They're not trying to show off with, I've got 30 things I'm doing. We focus on our key points, and it's working out extremely well. And emails too. We're trying to cut down on emails. We now pick up the phone and call somebody else, or we use Zoom chat and send a quick message that they can answer. And then you don't have to go through your mailbox at the end of the month because you have 1,000 messages and a lot of them are okay, thanks, that kind of stuff. So it's been a welcome change.
Right. You're figuring it out. The best way to get to the solution and move forward. And that's what great leadership does. So I'm really happy for you. I'm sorry that you had to go through all that volatility, but I'm glad that you're where you are now. So getting back to the feasibility study for the emergency department, it was, besides being held in a pandemic, you and I held a pretty standard feasibility study. So what were some of the key takeaways for you? And how did they help address some of these areas of volatility that we were experiencing with change in the pandemic and just everything that was swirling around in the atmosphere? What really rose to the surface for you?
I think most leaders, I'm putting myself in that group, we know it all. Just ask us, we know it all. We can look up the policy, we can tell you what it is, and we follow a certain pattern, and this is the way it is, and we've always done it that way. And even if we don't say that, that's how we act. And then when the pandemic hit, absent the feasibility study, we realized that all of our employees could work remotely. And you know what? They worked harder and they were more productive working remote than coming in the hospital every day. And in not just our department, hundreds, 300-400 people that went remote immediately. Obviously the nursing staff and medical staff couldn't, but we learned that. We learned as a result of taking on the feasibility study, a lot of the paradigms have been shattered because people said, oh, you can't do that, you can't do this, delay that. I think that, as we'll probably talk about, our donors were more welcoming and more forthcoming when you weren't sitting across the table with them. And we also didn't waste a lot of time. You know, it wasn't, can I get you a cup of coffee? Do you want this? You know, it was, you set up a time and we had asked some questions and they were very receptive. So it was just, to me, it was the time, again, the volatility that was in everything we did, including whatever it was we were locked down for here, where we didn't talk to anybody or leave our homes. And we just pushed through that and said, you know what, when God gives you lemons, make lemonade. And we've been drinking lemonade and we're happy about that. So.
Yeah. And in full disclosure to everybody listening, we did 45 interviews. And it was a combination. I did 40 of them. I think you did 5 with your CEO, and those were the highest level, those closely held, highest tier folks. I did the other 40, and they were a combination. We did Zoom, we did telephone calls, and then we did a handful in person, and we got it done. Like you said, we pushed forward and we did it, and folks were incredibly forthcoming. I mean, they really were. They really let us know what they thought. And as I shared with the group when we presented the study results, what was really heartening to me was it was the opposite of apathy. And that's really what I like to see, is that people really they really care about this emergency department and they really want to see it improve. And they may have things to say that we may not necessarily want to hear right now, but it's important that they're sharing them, because that means that at the base level that they care. And so for me, I just found it really rewarding to get to know all of them.
Yeah, and I will add that you know, Jennifer taught us to listen. I mean, we really were focused on listening. And I didn't mention, but our fire departments do not have ambulances. The ambulance service is run by the hospital. We have 8 EMS units in a old dilapidated garage we rent next to the railroad tracks at the bottom of the hill. So our community, when we talk emergency room, they look at emergency services. They think about the ambulance service, the helicopter service, and the room, the emergency room they're taken to. So we learned some really interesting stuff when we listened to what our donors were saying about what they would support. So we can get into that
yeah, no, I would love for you to expand on that. Tell us about your plans. Tell us about, you know.
So we went from looking to raise, you know, between $2 and $4 million for an emergency department program that was going to be a $20 to $24 million project, to now focusing on building an emergency medical base that would house our ambulances in a much safer and better environment right next to the interstate, easy access on and off. And that's because we listened to what people said. Well, it'll have a community room, and it'll go from us being part of the project to making this a complete project. We will fund the entire building of a new base. And our helicopter crew, which now has a couple of old rooms in the hospital, they will be in the same building as the EMS team because they all work together. So we're really excited about how that's going to look. We're excited about being able to announce that. We haven't announced it yet to anybody, but we will be. They're all waiting for the new emergency room. That's still going to happen. So
yeah, let's talk about that too. Yeah, so we haven't let go of the new emergency room. That's also going to happen, right? Yeah.
We've had smart investments, and we have enough money to fund 25 million or 20 million. You know, it doesn't matter. So for the community to know that they're going to own and build the start of the emergency call. So from, you know, 911 to the ambulances to all of that, helicopters if needed, and taking them to the emergency room. We're also going to, we don't have all of them finalized yet because we don't have the plans finalized, but we're still going to be doing naming rights for our emergency department in this campaign. So somebody could name the EMS building or the conference room that's in there. We're hoping that our auxiliary takes on the community center, and all of that stuff can be named, but we're still going to have all the opportunity to name the entire emergency room after anybody. And those dollars will be directed toward the EMS program. Any additional dollars will go to helping with equipment that doesn't make budget cut in the emergency room. So
And I think this is such an exciting thing that we uncovered because, I mean, there's a lot of worry that comes with, if I call that squad, are they going to have the ambulance available to me? Are they going to have, because of the tremendous uptick in mental health transfers that you're doing to St. Louis and all of this that we uncovered, this is a real concern and it is a real need, and the public does want to stand up and support it. And I think that it's exciting. It's going to be a really heartfult project, I think. And
interesting enough, the population really talks highly of the ambulance service. But I would say that the ambulance service, that department didn't talk as highly about the population. And in part, I mean that because they were driving rigs that weren't up to the latest and greatest. Their building really is just terrible, where they stay and where they sleep and shower and all that. The office for the director is kind of like the middle of the dining room, which is also the living room. And if they're sitting there, everybody can hear everything. It's just not a good environment. So when we went and have talked with our ambulance team, they are just elated, and they are going to want to get behind this program. They're going to have, a lot of input to the plans and also help us raise money. So they have lights and sirens.
So. A win-win. I mean, it's a win-win for everyone. I'm so excited for you. So as you move forward then, and you have these new and exciting projects, how do you continue to maintain and build these relationships in the middle of the pandemic? I mean, you're still new, you're still learning, you're still meeting folks. How are you continuing to inspire people?
Well, we've encouraged our team to stay as involved with the outside groups that they were involved with pre-pandemic, if they could. So I've been involved with Rotary. I'm going to be president of Rotary next year. Like Jennifer said, I'm new to town. I've been here now almost 2 years. But we did all of our calls on Zoom. And, the one thing I've got them sitting right here. I've gone through a lot of postage stamps, because if people haven't done it, now's the time to just write a note to any donor, handwritten, just say checking in. I know there's a lot going on. If you need anything, give me a call. And when we started vaccinating people, I got calls from all kinds of donors who just wanted to know how to make their, appointment, how to do this, just lots of questions. And the feedback's been great.
Yeah, because the foundation took such a huge role in the vaccination clinic. So let's talk about that a little bit. How did that come about?
Well, it's one of those things where to have a great capital campaign, you have to have a great annual fund. So you have to touch a lot of people and keep touching them. So when we were talking about starting these, we were selected as a site in Missouri for vaccines. And we had people driving from St. Louis to come over here, all kinds of places. The foundation stepped up because we weren't as busy as we were pre-pandemic. And we took on the role of registering people when they came in line, coordinating the lines, for the vaccine, and all the administrative side, I guess you'd call it the front end of that process. So we were there, we were talking to people, all donors or potential donors. It really was good for us to be in that position rather than, somebody from registration, or because there wasn't anything magic about it. You gave them the form to fill out, asked them a few questions, check their temperature, and on they went to the next station. But it gave us some phenomenal exposure. So
how many thousands of folks did you vaccinate?
I don't know the answer to that question. Thousands.
But that's incredible. I mean, what an opportunity to do some grateful patient, contact. I mean, that's
I think we vaccinated more than the population. So you can tell
that more than 20,000.
Yeah.
Wow. So we used to folks coming in from St. Louis.
Yeah.
You were a hot ticket.
Yeah, they would know how to call and when we'd open up slots. And there were people like, I don't know, you'd think they were trying to get Beanie Babies, so, but it was a great time. Again, God gives you lemons, make lemonade. We were having this situation, they couldn't get enough staff, and our team says, hey, we can step up and do that. And The clinics were either in the morning or evening clinics, so we still had our daytime to make regular calls and follow up. So,
love that.
Yeah.
So, what's one piece of advice you would give to maybe there's an organization that's thinking about doing a feasibility study, but here we are, we're, you know, we've got the vaccines, but we're facing another wave of the pandemic. We really don't know when this is going to end. What would you say to that person?
you know, when you look at a forest and there's no path to get out of it, you know, build a path, create a path, cut some trees down, make a way for you to get through it. And that's what I would tell you. Do it. You know, just do it. Don't overthink it. If your organization has a need, for whatever it is, or you're trying to determine if that need is there or whatever, don't be afraid that there's a pandemic. I think people will respect you more for doing work. And they also, which I'm sure most of you figured out, they have a lot more cash right now than they had pre-pandemic, because we have people that have been working that haven't left their house, and they're not spending money anywhere. So, and well, Amazon trucks are more frequent. So we signed up for Amazon Smile, so we get a percentage of that, and that's gone up really well for us too. But I would just say, don't be afraid. If you haven't engaged with somebody, get somebody, like Jennifer, who's done this now in a pandemic, to really give you some sound advice. And some of what she told me, I didn't buy into. I'm just being honest. But we went with it. We took a leap of faith on a lot of stuff, and it absolutely has been the right thing for us to do. So feel free to give me a call at any time, send me an email, but I'm happy to answer anything. But I would encourage you and any other senior leaders that you have to work with to seriously think about moving forward.
Yeah. Is there anything that you would have done differently? Is there anything you'd like to try again or do differently?
The only thing I might do a little differently is I probably would have been braver in reaching out to some people that we don't consider a higher level donor or even a donor. I think we did reach out to community members and other things, but I think there were some people we just didn't go after. And I think I would do that. And now that we know that nobody hung up on us, nobody shut us down. Nobody refused the appointment when we called to ask them. Nobody. Right. So that's the one thing I would have done. I would have been a little braver.
Yeah.
Yeah. So, but that would be about the only thing I could think of, is don't be afraid, be a little more aggressive with your list of who you're going to talk to.
Mm-hmm. No, it was a big study. It was a joyful study. Like I said, we talked to 45 folks, and they were all tremendously forthcoming, and we were able to use that data. And I'm just so excited to see where it's going to lead. Is there anything else you want to share?
No, like I said, I just think it's a great time in fundraising. There seems to be more money available. There also seems to be a cause. One thing with our ambulance base that we're going to put in, they're going to be 2 ambulances deep, open up the back door and the front door. So if we have another pandemic, we'll have a place now for drive-through vaccinations. And in the rain and the cold here, that was a real tough challenge for us when we had so many people wanting to get vaccinated with the snow and the ice. And so we have been able to look at that, and we'll be building the first, building and ambulance base in anywhere post-pandemic. So we'll also have a lot of opportunities from Homeland Security, Health and Human Services, and all those departments to take a look at what we're doing. So it really is a great time to take on those projects.
Yeah. Well, thank you so much. I can't wait to see how it all turns out. Thank you for sharing just a little bit about what we did and what's to come. And I appreciate you, Dave. Thank you so much.
Anybody ever's driving through Rolla, Missouri, right on Interstate 44,
great little town. I absolutely love it.
Just get off and ask for the foundation. You're welcome anytime.
That's right. That's right. I always enjoy my time with you guys. All right. Well, thank you so much, Dave.
Thank you. Have a great day, everybody.